like to address the board tonight?
Mr. President, you have Jessica Truglio.
All right. Are we bringing this?
Sorry, I'm unmuted.
Okay, go right ahead.
I thought it was going to be automatically unmuted. I'm sorry about that. Here I am. Okay. Good evening, Board of Trustees, Chancellor Claire, and college presidents. My name is Jessica Truglio. I am a counselor at the Educational Access Center at Skyline College. I've been teaching in this district for 5 years. My experience at Skyline and in the district has been great. I love the students we serve, and I feel it an honor to work with such amazing faculty, staff, and administrators. On behalf of our faculty colleagues at the 3 colleges, I am here to present a petition that AFT organized in partnership with the district counselors. The petition asks the Board of Trustees and Chancellor to create a more transparent process to guide the in-person return of counselors. So far, we have collected 287 signatures representing both instructional and non-instructional faculty from all 3 campuses, and in total represent over 1/3 of our faculty. The petition will be presented to you this evening by an AFT representative who is attending the board meeting in person. I will read the text of the petition to you now. Counselors in SMCCCD are being required to come back to campus to provide in-person counseling in fall 2021. However, the policies and processes about who will come back and when are completely inconsistent across the 3 campuses. At Skyline, counselors are being required to come back to provide 25% of appointments in person, starting November 20th. At Cañada, counselors will be required to return to in-person on October 4th. At CSM, counselors were told they could volunteer to start in-person services at some point in October. Our counselor colleagues were not asked for their input, and they did not have the opportunity to take part in the decision-making processes regarding their return. They are not clear about the rationale behind the different dates and protocols that have been decided for them, and that seriously impact their lives and their students' lives. Neither the district nor the local administration have addressed the COVID-related health concerns specific to faculty with counseling duties. We call on San Mateo Community College district administrators and board to 1, create a district-wide plan for the return of in-person counselors that is consistent across the 3 campuses for fall 2021. 2, commit to making all decisions around dates for return and the process of deciding who will return transparent with input from counselors. 3, conduct a district-wide survey that assesses current student needs for in-person counseling service and share those results with counselors. 4, work together with representatives of counseling departments at all 3 campuses to ensure the following: the safety of counseling spaces, clarity about appointment policies and protocols around mask mandate enforcement. 5, allow counselors to assess their personal level of risk were they to return to on-campus work. And 6, immediately implement a district-wide system that verifies the vaccination status of students. As counselors, we work closely with students, typically in small enclosed spaces to ensure privacy and confidentiality, building our students' trust and providing them with the resources they need to succeed. We do more than simply help students choose classes. We give them wraparound support. How can we be expected to play this essential role in our students' lives if we don't feel safe in our own workspaces and when we are not consulted about the conditions under which we will return to in-person work? Just this morning, I had an experience that I'd like to highlight. I worked with a student in person on Tuesday morning for 2 hours in fairly close quarters, completing a learning assessment. I was scheduled to continue this assessment this morning. She emailed me after I was on campus saying she was running late because she woke up feeling unwell, but was on her way. Thankfully, I was able to reach her in advance and advise that we reschedule. I found out that although she had planned on coming in to see me, she felt ill enough that she had also planned on getting a COVID test later in the day. Based on our current protocols, I had no way of knowing in advance that she wasn't feeling well or finding out until after the fact whether or not she indeed was COVID positive. These are the kinds of risks that we as counselors are facing. On my campus, I volunteered to resume these types of appointments due to the need I saw in my students. No counselor should be forced to take on this level of risk, however, if they are not comfortable. Counselors need transparent, consistent protocols at all 3 colleges, and we need to be included in the process of creating those protocols. Thank you for listening and for taking our concerns seriously. Next, we'd like to share a few of the comments from faculty who signed the petition. Either Darian Chan or Catherine Herrera will share these now.
Hi, can you hear me?
Yes.
Thank you. Hi. Give me one moment. Thank you. Good evening. My name is Darian Chan, and I am a counselor currently at Cañada College. I've been with the district for 16 years. I started at College of San Mateo. I then moved on to Skyline until where I am at Cañada now. Many of the faculty members who signed the petition left written comments. We've chosen just a few of them to share with you tonight, and I would like to just go through them. One of them says, I am willing to come back to campus, but it concerns me to meet with students from 30 to 60 minutes in a very small space. I'm also unclear how we are verifying student vaccination status and whether we are allowing exemptions. Another commenter said, I understand that we are trying to serve students, but we are not at a point in the pandemic where mandating in-person, indoor, close quarters, unverifiable vaccination status appointments makes sense. Have volunteer, large office with windows, student requested in-person appointments only, please. When will the MOO or subsequent variants come to campus? A third commenter said, please bring the people who will be directly affected by these decisions into the conversation and making these decisions. A fourth said, transparency and safety go hand in hand. A fifth, our district needs to have clear safety protocols that are effectively communicated internally and externally. Other higher education institutions, including UCs and CSUs, have been able to achieve this. We must continue to serve our students with a priority on effective health protocols so our students feel safe coming back to campus. Another commenter, I agree that unless serious measures are taken, the counselors are being put at especially high risk and being required to return to campus. I feel their list of concerns is entirely reasonable and needs to be fully addressed. The rest of the campus is watching how this plays out, and if this is handled poorly, it will damage morale and cause a loss of confidence in leadership. Another comment says, at CSM Personal Counseling Services, we are talking about going back to campus partially sometime in October. However, many students prefer remote counseling appointments because most of the students are still taking classes online this semester and they also have safety concerns. I feel that it is okay to have an option for personal counselors to work from campus and provide some coverage in case of emergencies on campus. However, it should not be a requirement. I don't understand where the 25% face-to-face requirement at Skyline came from. One more commenter said, I am writing to support counselors' choice to work remotely. And by polling of students, the majority prefer to take classes online. Such decisions should be made in consultation with counselors who have direct experience about the needs of students. There are two more. More information should be collected from students to determine how much in-person counseling services are necessary. Return plans for counselors should be the same across the district and consistent. The last one that we have that we wanted to include says, why must anyone return to in-person work right now, given the highly contagious Delta variant and the fact that many breakthrough COVID infections are occurring in fully vaccinated people? Thank you for giving me the opportunity to share some of the comments we received in the petition. We hope that you will take this issue seriously and make the changes that are being requested by the petition signers. Thank you very much for your time.
Thank you. Is there anyone from CSEA Chapter 33 that would like to address the board? Not tonight. Anyone from AFSCME AFL-CIO Local 829, Council 57?
Mr. President, you have Tony Burrola.
All right, thank you.
Hello, can everyone hear me?
Yes.
Okay, great. Good evening, board members, staff, and community. My name is Tony Burrola, and I am the AFSCME Chapter Vice President and Utility Engineer at Cañada College. I am excited for this new school year, new buildings coming online, and having students back on campus. I am so proud of our AFSCME members, their hard work, diligence, and continued commitment to maintain beautiful, clean, and sanitized facilities. AFSCME prides itself on our commitment to facilities excellence and being one team. Our terrific mentors, Jose Nunez, Michelle Radolfsky, Karen Pinkham, Robert Gutierrez, John Doctor, Luis Carranza, Brian Evans, and Tyrone Armstrong, helping us achieve these goals every day and aim high to accomplish the best. AFSCME will continue to work hard to ensure that our facility, students, and community have the absolute best facilities in the state. We need the district board to not only verbally acknowledge and appreciate our work, we need that backed up with a cost of living raise for this fiscal year. Recently, CNBC noted that inflation is up 5.4%. In 2020, the median income in this county for a single person was $121,800. Low income being $97,440, and very low income at $60,900. Our district pays custodian annual salary at top step $62,736, and groundskeeper annual salary at top step $66,972, both below low income. These employees are working full-time jobs and trying to stay out of poverty. I am a father of 4 terrific kids. Based on my salary here at the district, I am considered to be extremely low income and qualify for social welfare with a full-time job. Let's all think about that. Now is the time for the district board to provide the cost of living increase for the AFSCME unit to help keep our excellent employees and not contribute to poverty in this county. I thank you for your time and look forward to moving forward in a positive way for the AFSCME membership. Thank you.
Thank you. Next item in the agenda are statements from a public on non-agendized items. We would welcome you to speak if you're in the room or on Zoom. There will be a 3-minute time period for this, which is the policy of the board. The Vice Chancellor will reset the clock. And who is our first speaker?
Mr. President, your first speaker is David Lau.
All right, David Lau.
Hello, everyone.
Hello, David.
My name is David Lau, and I'm an English professor at College of San Mateo. I'm part of an extraordinary department in college. I'm also elected chapter chair of Local 1493, American Federation of Teachers. In what follows, I've tried to encapsulate a number of questions and comments that I have received from faculty members about vaccines and reopening. The vaccine requirement is a serious one. So how seriously are we taking the requirement? Just today, President Biden has a new order that will mandate 100 million Americans be vaccinated. This order reaches deep into the private sector. And there's also weekly testing requirements. Another comment that we've seen a lot of: when will the system for students reporting their vaccines be in place? Another comment that a faculty member made to me that I thought was important to share is the following question: are we trying to make things as safe as possible for students and employees? And then finally, are unvaccinated employees going to be required to undergo regular testing? One final note that I wanted to bring to the board's attention is the religious exemption in some of the language that we're using. Is this a legally valid reason for an exemption to the vaccine? There's a Los Angeles Times article I'd like the board to take note of. The dateline is September 3rd. and it was titled Religious Exemptions Add Legal Thorns to Looming Vaccine Mandates. That article and several others have noted that in 2015, California abolished non-medical exemptions for vaccination requirements in school-aged children. Great to see everybody. Thanks for all your hard work, and I'll yield my time.
Thank you very much. Are there any other members of the public that would like to address the board on non-agendized items?
I see none at this time, Mr. President.
Thank you. Then we'll move on to information reports. The first one is